Today, we want to talk about something that has really affected a lot of people. We want to look at the issue of Rhesus, the Rhesus factor, looking at how it can affect an individual, especially as it pertains to pregnancy, as it affects the mother and also affects the child. This has been a subject that has brought a whole lot of pain and tears to people, leading to various issues like miscarriages. So, Ma, I know you've been there, you've seen it all, you've heard people tell you. So I want to ask, what is Rhesus? Let's talk about Rhesus at itself. What is this Rhesus factor?
The Rhesus factor is simply that plus or negative, or the positive or negative signs that are being attached to the blood groups.
So what are like the risks that may come from this incompatibility, the fact that the mother's body has produced antibodies? What are the risks? Are they risks to the mother? Are they risks to the child?
Sure. Because the woman's body has seen this as a foreign body, it must make conscious effort to eject that foreign body, and that results in miscarriage.
Okay.
So you see so many women come up with miscarriages. I've taken in for like 3-4 times, and then I still miscarry the child. And most of them attribute it to that the mother-in-law most commonly, and then other, factors, not knowing that it is as a result of an Rhesus incompatibility.
Okay. So it has happened, and the child that comes in, maybe the first pregnancy. So what happens to the subsequent children?
All right. I like to intimate that most often the first child does not get affected. Yes, there is an incompatibility. Now, the effect or the impact now is on subsequent pregnancies, because at this point, the women have had enough time to develop these antibodies. And so as this fetus, the new one comes
just coming in
out. And so you will see most women say, I had my first child in the year 2010. And since then, I have been battling to, keep another pregnancy. Not that I have not taken in, but I keep miscarrying.
Okay.
And so one question is, what is your Rhesus factor? What is that of your husband?
Okay.
So from experience, I've had an encounter with this kind of couple. And so the woman kept complaining, why can't I keep, to my pregnancy? Why can't I sustain a pregnancy after the first one? I have prayed, I have done assignment, I have done this. Then I asked her, what is your blood group? Very confidently, she said, O. And then what is that of your husband? She said, O. What is the Rhesus factor? Ma? What's that? And so I'm like, is it a plus or a minus?
Okay.
Is it positive or negative? She said, I don't know.
Is it possible that this Rhesus issue can, like our people will say, can be done on you by somebody?
Hey, God.
Like, can. So you sometimes when things happen, like people
from
say,
the witchcraft,
yeah.
Coven.
It was like somebody did this to me. I know that woman that did not like my mother. So is it possible that Rhesus sensitization incompatibility can be something that someone did to you?
When you are in a relationship, first try to know the Rhesus factor of your partner just before you fall into love.
Shawarma go allow.
Just before you fall in love.
Date night will not allow us. Movie night.
I'm not saying you should not fall, but I just said just before you fall.
Dive inside.
There's so many ladies out there that forget that they were once exposed to a partner with an Rhesus positive. So they get into another relationship and suffer these consequences. So my advice to them is, once you experience the first miscarriage.
So what's the way out?
Graciously, there's something that could be done to avert all of this.
Hello, everyone. Welcome to another episode of the Intimate Matters podcast. And as usual on this podcast, we take you on a deep dive into the world of sexual and reproductive health, and we teach you all you need to know about your sexual and reproductive health. And for today, we bring to you another interesting conversation. Today, we want to talk about something that has really affected a lot of people. We want to look at the issue of Rhesus, the Rhesus factor, looking at how it can affect an individual, especially as it pertains to pregnancy, as it affects the mother and also affects the child. This has been a subject that has brought a whole lot of pain and tears to people, leading to various issues like miscarriages, which we'll expand as we go forward. And today we're joined by one amazing personality, someone I regard so much. And today we have Nurse Imabong Johnson. Thank you for joining us.
Thank you.
So, I know you've been there, you've seen it all, you've heard people tell you. So I want to ask, what is Rhesus? Let's talk about Rhesus at itself. What is this Rhesus factor?
All right. Thank you for having me, Nurse Akwaowo. Rhesus factor simply is the protein that is found on the surface of the blood group. What do I mean? We have basically about 4 blood group types. We have the A, we have the B, we have the AB, and we have the O. Now, notice that you will always find either a positive sign or a negative sign attached to these blood groups.
Okay.
So you have something like A plus,
okay,
B plus, AB plus, O plus, and these also have the negative ones.
Okay.
So the Rhesus factor is simply that plus or negative, or the positive or negative signs that are being attached to the blood groups.
Okay, so that means if I'm actually B positive, so that means I'm blood group B, then I have a
Rhesus factor positive.
Okay, all right. So sometimes people say there is incompatibility. Sometimes they say it's compatible. Oftentimes this comes when people want to get married. People are doing screening, genotype, they're checking everything. And now, of recent, there's been people really looking at Rhesus, whether you're compatible or incompatible when it comes to Rhesus. So what do we mean when we say there is Rhesus incompatibility?
Thank you very much. Before now, people dealt so much on the genotype.
Okay.
People didn't really know about Rhesus factor, let alone that there could be a form of incompatibility.
All right.
Now, so Rhesus factor incompatibility does not really affect the man and the woman.
Okay.
As we would consider the genotype.
Okay.
Now, Rhesus factor incompatibility comes in when the woman is pregnant with a child.
Okay.
And you just said you were B positive. And so let's hope that the very beautiful damsel that will come into your life is maybe B negative.
Okay.
Now, she's pregnant with your child. And this child, by default, will carry the positive from the father.
All right.
We're talking about Rhesus factor now.
Okay.
Not blood group,
Okay.
not genotype. Talking about
the factor itself.
The Rhesus factor. So it has been established that every fetus will carry that factor from the father.
Okay.
And so if you're positive, there is that likelihood that your child will be positive. And we do not know if your madam will be negative or positive, but in this context, let's use negative.
All right.
And so she's negative, carrying a Rhesus, and Rhesus, not a. Sorry, we're talking about vowel sounds here, and this particular Rhesus factor is a vowel sound,
okay,
and then a diphthong type of vowel sound. And so we'll be talking about an Rhesus factor.
That's why she's my teacher.
And Rhesus, not a Rhesus.
Okay.
Okay, so she's carrying an Rhesus positive fetus. And so, what happens when there is a presence of foreign body in the human body?
Okay.
There's what we call antibody. This antibody helps to fight whatever it sees as a foreign body.
Okay.
And so when a woman is pregnant with an Rhesus positive child, the body now sees it as a foreign body. And so the woman, her system begins to develop antibodies that fight this foreign body.
Being the baby.
Okay. That is that incompatibility.
All right. So
there's a negative woman, a positive child, they are not compatible. So that is simply the Rhesus incompatibility.
Okay. So if a positive man, and Rhesus positive man marries a woman with negative and they have a child or they get pregnant and most likely the child is positive, the mother's body will develop antibodies to fight, and that's Rhesus incompatibility. All right. So what are like the risks that may come from this incompatibility, the fact that the mother's body has produced antibodies? What are the risks? Are they risks to the mother? Are they risks to the child?
Sure. Because the woman's body has seen this as a foreign body, it must make conscious effort to eject that foreign body. And that results in miscarriage.
Okay.
So you see so many women come up with miscarriages. I've taken in for like 3-4 times, and then I still miscarry the child. And most of them attribute it to either the mother-in-law, most commonly, and then other, factors, not knowing that it is as a result of an Rhesus incompatibility.
Okay, because I think sometimes we'll come back and look at why it's always the mother-in-law. That's why we are men. Maybe men are always they go part. So
excuse me?
Yeah. That's have you ever seen a fight between father
to what we were doing?
Okay. So now when we look at issues like this, so like you said, the mother develop antibodies and fight the child.
So miscarriage is one of the most common a thing that results as a result of this incompatibility.
All right.
And then we have something like stillbirth. She managed to carry the child to term, but then still lost the child.
All right. So we'll look at this one. It has happened. So what happens subsequently? So it has happened and the child that comes in, maybe the first pregnancy. So what happens to the subsequent children?
All right. I like to intimate that most often, the first child does not get affected. Yes, there is an incompatibility, but, during the first pregnancy, the woman's body does not develop enough antibodies. That is antibodies enough to eject this baby.
Okay.
And so she carries this baby to term. Where she might lose this baby at the point of delivery that we call stillbirth could be maybe the child was distressed and came out, very weak, and maybe she lost it. But most often, the first child always gets to live because the woman could not develop antibodies enough to eject.
Okay.
Now, the effect or the impact now is on subsequent pregnancies. Because at this point, the women have had enough time to develop these antibodies. And so as this fetus, the new one comes
just coming in
out. And so you will see most women say, I had my first child in the year 2010. And since then I have been battling to, keep another pregnancy. Not that I have not taken in, but I keep miscarrying.
Okay.
And so one question is, what is your rhesus factor? What is that of your husband?
Okay.
So from experience, I've had an encounter with this kind of couple. And so the woman kept complaining, why can't I keep, to my pregnancy? Why can't I sustain a pregnancy after the first one? I have prayed, I have done assignment, I have done this. And then I asked her, Mrs. Paul, what is your blood group? Very confidently, she said, O. And then what is that of your husband? She said, O. What is the rhesus factor? Ma? What's that? And so I'm like, is it a plus or a minus?
Okay.
Is it positive or negative? She said, I don't know. As a matter of fact, it was when we wanted to do our wedding, the church asked that we do it. We did it, and we found out that he's O, and then I am O.
All right.
Now, that takes me to something very important.
Okay.
Now, in this case, the husband is also, I'm using is because he's still alive, is also negative. The woman, negative. So that brings us to what happened.
All right.
I had to excuse the man and then had a one-on-one talk with the woman. Now, this is what happens in most cases that both couple have the same rhesus factor, but still experience miscarriages that are due to rhesus incompatibility.
Okay.
It could be that when the woman was in the high school, she got pregnant for another man who obviously
was rhesus positive.
Rhesus positive.
Okay.
And so she did not bring to term, she did not bring to life that child. She aborted the child. But that child, that rhesus factor from the man is still in her system.
Okay.
This is the long-term impact of rhesus incompatibility. And so she's now married to another person who is negative, but her body has built up enough antibodies to fight whatever comes in as a foreign body.
Okay.
And so from the start, with this other person, she has miscarriages.
So,
and when we established that, it led us to something else.
Okay, so because that's very important that you pointed that out, because oftentimes you've had couples come and say that, when we're checking the rhesus, they're compatible, but yet we're seeing this. And that goes to show that whether it's an abortion, whether it's delivery, stillbirth, or a live delivery, that it can happen that the reaction had already occurred and the sensitization has already occurred. Hence, we can have the long-term effect. So, what's the way out?
Graciously, there's something that could be done to avert all of this, but ignorance, makes people to come down with things that are preventable. Okay, so what just needs to happen is, in that case, I told her, I asked her, is your husband aware that something like this happened?
Okay.
She was like, no. I said, we have come to the time that we need to confess to the father. Because your husband would need, or you would need to be taking a particular injection we call RhoGam injection. It is not given for any other thing. It is given to women whose rhesus factor is not compatible with that of their partners.
Okay.
So whenever you take in, at this point you cannot take in. You cannot take the RhoGam injection, I mean. So whenever you take in, when you are 28 weeks gone, you should have the first dose of RhoGam.
All right.
That will prevent your body from building up
the antibodies
that would, fight against your fetus that it would see as a foreign body.
All right.
And then within 72 hours after delivery, you should have a second dose. That will prevent your system from further seeing or getting exposed, we call it sensitization, to upcoming pregnancies. So you would be able to conceive without miscarrying, and therefore every time you conceive, when you are 28 weeks gone, you should have a shot. And upon delivery, you should have a shot. And not during pregnancy. If you want to have a safe abortion, you should also have it. Because if that woman had known, this would not have happened. So after every form of abortion, delivery, provided there was a presence of a fetus in the utero, you should have 2 shots of RhoGam injection.
All right. So like Nosima Bong had said, anytime there is a child inside the womb, and whether you bring the child to life or you choose not to bring the child to life, if you realize that there is an incompatibility between you, the lady, and the person who caused the pregnancy, it's important that you take this injection to ensure that there is no sensitization, so that as you move on with your life, as you go further into the future, if you want to have a child, it will not become a problem. There's another aspect I want to look at, because when we're looking at this, it's pointing to women, and men out there feeling that they're not there. Is it possible to have this issue of incompatibility when it comes to blood transfusion?
Very well. very well. Now, when a woman is being transfused of blood, we will screen for HIV, for malaria, for hepatitis, and the rest. Now, out there, everybody believes that I am blood group O. I am a universal donor. And so they do not pay attention to the Rhesus factor. This woman is an Rhesus negative, and you're bringing an Rhesus positive blood. We call it universal donor. In the long run, that woman might not react. We have what we call blood transfusion reaction. She might not react for you to see that she has reacted to this blood, but these, let me call it elements, are lying dormant in the woman, waiting for when she would conceive. I don't know if you're following me.
Yeah, I understand.
And then that positive blood that she got, a B negative person, B positive, it causes this form of problems that result in Rhesus incompatibility over time.
Okay.
Not like immediately. Over time.
All right.
But if a pregnant woman is being transfused directly, that is when she might have this problem like almost immediately, though some still escape. So the percentage of one having this Rhesus incompatibility from blood transfusion is not as much as if the person was pregnant and got it directly from either the partner.
Okay, so if it happens through blood transfusion, it has to lay dormant and wait till when there is pregnancy and when there is conception. All right, so it's always very important that when you go to the hospital to get a blood transfusion, you as the patient has the right to ask about the blood that is being transfused to you, because in as much as medical professionals try not to make mistakes, the best of any human is still human, and humans are prone to mistake. So due to, the stress of work or to the hecticness of what they're doing, they might say, this is, let's say you are AB, because that's always the issue with AB. They say they are universal recipient.
Yes.
So they can get from anyone.
Anybody.
So they just say, anybody bring blood. And then they don't know that there is issues as it pertains to Rhesus. Is Rhesus sensitization, is it something that can be inherited? Like, is it something that can be passed from mother to child? Or is it just the Rhesus that can only be passed?
We're paying attention to Rhesus.
Okay.
And then I did say that the Rhesus factor, whether negative or positive, comes from the father. That automatically means that it is genetic.
Okay.
So that child will automatically get the factor from the mother. So we just read that the father is compatible, that is, have the same kind of Rhesus. What interests me is that if a woman is positive and the man is negative, there will be no form of incompatibility. It is only when a woman is negative and the man is positive that we have this incompatibility.
Oh, thank you so much for mentioning that, because oftentimes when you say these people, it's normal human behavior that they start to mix it up. You tell them that it's when a woman is negative and the man is positive, that's when incompatibility comes. They will ask, what if we are both negative? What if we are both positive? So Rhesus incompatibility only comes to play when the woman is negative and the man
is positive.
By the man, it might not be the husband. It might be the person who is responsible. The person who is responsible for the pregnancy is actually positive, and that becomes an issue. So what are the ways you think that we can try to reduce this to the barest minimum? I know that universally, the number of people that are actually Rhesus negative are on the low side, approximately like 15% of like the total population. Yeah. But it's looking as if this problem is popping up more. Maybe it
recently.
maybe it was before, but people didn't know. So what are the things we can put in place so we can see how we can drive this at least to the barest minimum if we cannot eliminate it?
First and the utmost, there should be a proper screening. recently there are lots of technical errors. You see someone say, I am blood group this, and by tomorrow is being given another. Let me use that word. And you know that this is clearly a technical error.
And I think this has also been happening with genotypes.
Good. So there should be a proper screening. I do not want to discredit free testing facilities, but if possible, walk up to where you can pay to get tested, because when things are done freely and many people troop in there, the people carrying out this test might be weak.
Okay, so before you proceed, that's very true, because I've had a couple of people come, especially there was this news trending on social media a couple of months ago where a couple got married. I think 1 week or a month into their marriage, they divorced.
I saw it.
Yeah, because of genotype issue. Now, what happened? They got their genotype from school. You know, most tertiary institutions in Nigeria, once you want to get in, they actually do genotype. And I look at, for example, the one here, University of Uyo, the number of students that get into that school every year, and one lab is supposed to run a test for over 1,000 students.
Thousands.
Now, let me just take over 1,000 students. And how can they cope to give? Because with the high volume of tests, there's room for error. The higher the number of people, the higher the room for error.
Definitely.
So it's essential that you ask some people, what's your genotype? My mother told me. Now, your mother did this test in the 80s.
Many years ago.
Right. There are newer equipment and newer procedures that could be done. What's your genotype? I don't know. They told me it was. I think that, thank you for really pointing that out. So it's essential, like she said, that when you want to screen yourself, you go to somewhere that at least you can trust what is done. So please, can you go on my other things that need to be done to
Okay, so after the first test, I would still hammer that you go for a confirmatory test. Initial test is different from a confirmatory test. So after the initial test, you should go to a place, another place, not the same facility, for a confirmatory test. That is when you will know that you are A positive or B positive. Now, away from that, when you are in a relationship, first try to know the rhesus factor of your partner just before you fall into love.
Shawarma go allow.
Just before you fall in love.
Date night will not allow us. Movie night.
I'm not saying you should not fall, but I just said just before you fall.
Dive inside.
Ask the person, what is your blood group? What is your rhesus factor? What is your genotype? And if there is any form of, I am not sure, walk to the person. From there, you can go for the date night.
Okay.
But get this fact straight, because I've watched so many movies. One night pregnancy, that pregnancy can land you in, irreversible stuff. Imagine someone being in her 60s or 50s and just got to know that her wait all this while to conceive is as a result of Rhesus Incompatibility.
From a one-night stand. 20s.
And at this point, she's already in a menopause. That means, although there are assistive, fertility devices, but how many people
can afford it?
Can afford this? So some things are actually preventable.
Okay.
So that is for the testing, and that is for before you enter into relationship or while in relationship, you should get this done. Now, at every point in time or at any point in time, you would have to be transfused. Be sure of the blood that you are receiving. Let people know you as being so curious and so inquisitive. It's for your life. They say a second can save a life. So one thing can actually take that life. So you have to be sure.
All right. So that's very, very important out there. So it's important that you test yourself. Go for the first one. Go for a confirmatory test. And also when you are in a relationship,
know your partners.
That relationship is very, very important. I think people need to really emphasize this, because oftentimes they get so much emotionally invested. And when emotion comes in, it clouds reason. It clouds logic. So most times you see people, because there are questions like that. You see people come and be like, I know maybe we are not compatible genotype wise, but I love this
But
person. I love this person. So please, it's essential that you do what you need to do before the emotions.
Before you fall.
Yes, before the
You fall in
emotions
love.
come into play, so that you do not take yourself out of that. So let me just ask this, right, to put it out there. Is it possible that this Rhesus issue can, like our people will say, can be done on you by somebody?
Hey, God.
Like, can. So you sometimes when things happen, like people
From
say,
the witchcraft, say,
yeah.
Coven.
It was like somebody did this to me. I know that woman that did not like my mother. So is it possible that Rhesus sensitization incompatibility can be something that someone did to you?
Just like HIV, just like hypertension, just like diabetes, there's no medical condition that can be done on someone. Let's use that word. So you are a negative or a positive, and then you met with a positive man. That is what happened to you. In fact, that is the done in quotes.
So that means somebody did it, but it might have been you that did it to yourself.
You're the one that took yourself to receive it yourself. So there's nothing like from the witchcrafty world or someone casted it upon. No, nothing.
Okay. So like you've heard, it's a medical condition. It's because of the fact that you've exposed yourself to this issue. Nobody can do it to you. Truth is, maybe as much as people would wish they could do it to you, nobody can. And we
bind them.
Do for you. No, we bind them as always. So it's important that when you go out there, those are some of the things that you need to look out. It's really affecting a whole lot of persons. You're seeing people having reoccurring miscarriages, and this has been one of the things that have actually been pointed out. Miscarriage, it's something that you should not wish on someone, because not just about the physical pain that comes with it, the emotional trauma that comes, the societal and cultural trauma that comes with it, especially in this African climate. Don't allow it to happen to you. So it's important that as individuals, especially for the ladies, please try to know the Rhesus factor of the person you're having sex with. Now, it's important just in case pregnancy occurs, and when it does, please, if you see that you're incompatible, do the needful by going to take the injection that is needed for this to be done. So thank you so much, Nurse Imabong, for gracing us today with this knowledge and telling us all we need to know. So any last words for the viewers out there as it pertains to Rhesus and their sexual and reproductive health in general?
All right. So, there's so many ladies out there that forget that they were once exposed to a partner with an Rhesus positive. So, they get into another relationship and suffer these consequences. So, my advice to them is, once you experience the first miscarriage, and it is not related to cervical incompetence or any other thing, other causes of miscarriages are ruled out by your gynecologist. You should meet with, open up to your gynecologist that maybe you were once in a relationship and you conceived, you took in, that is, you were pregnant, but you were not just ready to bring the child to life, and so you terminated. Every sound gynecologist will have his or her mind back to the Rhesus factor. And so I have had a case where we just decided to give a try. We have done everything. So, apparently this woman is fine. And then we just had to give a try. If God blesses you and you happen to take in again, come to the hospital, we'll give you this injection. So when she was 28 weeks gone, that injection was administered. And then graciously, she gave birth. Wow. And then within 72 hours, we gave her another shot. She has about 2 children now. So this is something that if she did not open up till now, she would still be suffering, praying, fasting, doing assignments. But we don't get to see the seats, Sha. Nobody comes our way to do assignments. So we could have access to those things. But then just open up to a gynecologist, a sound gynecologist will have his or her mind back on the Rhesus factor and see how to help you.
All right. Thank you so much, Nurse Imabong. So it's important that when issues like this happen, you look back and you try to look at your medical history across your life stages. Yes, your past relationships, because it's quite very important. And it's why on this podcast and on other health platforms, we advise that you need to be very cautious when it comes to your sexual and reproductive health, especially when you want to indulge. There is a reason they say you should have safe sex. There's a reason they say that you should have consensual sex or for whatever reason. And that also goes to point to people who may have forced sex, like rape. Because it's important. It's important that if things like this happen, that you go to the hospital. It's why people are being told that when you're raped, aside from the trauma, aside from the stigma,
go to the health facility.
Go to the health facility. These are the kind of thing that is being assessed to prevent. God forbid, you may have been raped when you were like 20. If
20
this
is a big girl, say 14.
14. If this help is not offered, right, it may become something that will haunt you in your 30s, in your 40s, and this is not the way that is actually supposed to be. So knowledge is very, very important, and that is why we at the Intimate Matters podcast, we bring this knowledge to you, and we hope that you don't just have the knowledge, that you put this knowledge into practice, that you share this knowledge with people around you. When you're watching this podcast, call your neighbors, call your friends, even call your enemies.
Let them stand outside.
Yes, let them stand outside, because for those who have enemies, it's important your enemy live to be your enemy so that you can prepare them, so that they will see as God will be blessing you, because we know that even the people that are trying to come against you will not be able to succeed. So this is where we close the curtain on this episode of the Intimate Matters podcast. Thank you so much for joining us. And as usual, we are glad to take you on this journey to share with you things you need to know about your sexual and reproductive health. And today we had the amazing Nurse Imabong Johnson, who came to share with us as it pertains to Rhesus factor, incompatibility, and sensitization. I am the one that is the pilot on this ride, and my name is Nurse Akwaowo Akpan. And this is us telling you thank you so much, and to let you know that on the Intimacy Matters podcast, we believe that your intimacy matters, and that is why we discuss issues about it. See you next time. Please do not fail to subscribe to our channel and to comment, and also join the official social media platforms. We'd like to connect with you on WhatsApp. There we can share knowledge and we interact. And until we come your way next time, this is bye for now. Thank you.